Ivermectin is a small tablet that changed the lives of millions. For years, doctors used it to fight dangerous parasites that live inside the body. In many countries, it is seen as a miracle medicine. But what if I told you that this same medicine can also cause effects that most people never hear about? Effects that are not always written in big letters on the label. Effects that can silently affect your body, your brain, and your safety if you don't use it correctly. In the last few years, ivermectin became famous on social media. People started using it for things it was never meant for. Some followed doctors. Others followed internet advice. And that is where problems began. Many people thought it's just a simple pill. But the truth is very different. In this video, I will reveal 7 hidden effects of oral ivermectin that most people do not know. These effects are real, documented, and important to understand. My goal is not to scare you. My goal is to educate you and protect you. Because knowledge is your strongest protection. So stay with me till the end. This might change the way you see this medicine forever. Hidden effect number 1. Serious effects on the brain and nervous system. Most people think ivermectin only works in the stomach or blood. But very few realize that it can reach the brain as well. In rare cases, ivermectin can affect the nervous system. This is one of its most hidden and dangerous effects. Some people have reported feeling extremely dizzy, confused, or weak after taking it. Others have experienced shaking, loss of balance, blurred vision, and even fainting. In severe cases, there have been reports of seizures and coma. This does not happen to everyone, but it is serious when it happens. The risk increases if a person takes a higher dose than prescribed, or if they have a weak blood-brain barrier. People with certain genetic conditions or liver problems may also be more sensitive to these effects. The scary part is that many people don't connect these symptoms to the medicine. They think it is stress, dehydration, or low blood sugar. But it could actually be the drug affecting their nervous system. This is why self-medication is dangerous. If you or someone you know starts feeling unusual confusion, extreme drowsiness, or trouble walking after taking ivermectin, it is not something to ignore. Medical help should be taken immediately. The brain is not something you can afford to experiment with. Hidden effect number 2. Dangerous interactions with other medicines. Another hidden danger of ivermectin is how it behaves when mixed with other medicines. Most people don't realize that one pill can change how another pill works. Ivermectin can interact with common drugs like blood thinners, sleeping pills, anti-seizure medicines, and some antibiotics. These interactions can make the other medicine stronger or weaker in the body. In some cases, this can lead to internal bleeding, extreme drowsiness, or dangerous changes in heart rhythm. For example, if a person is taking warfarin or any other blood thinner and they use ivermectin without informing their doctor, the blood could become too thin. This increases the risk of internal bleeding, nosebleeds, or even bleeding in the brain. The person may not notice until it becomes an emergency. The biggest problem is silence. People don't tell their doctors everything they are taking. They think, it's just a small tablet, it won't matter. But it does matter. Every chemical in your body affects something else. That is why doctors always ask for a full list of your medicines. Without that, even the safest drug can turn dangerous. Ivermectin does not work alone. Inside your body, it becomes part of a complex system. Hidden effect number 3, severe and life-threatening skin reactions. Most people expect a medicine to fix a problem, not create a new one. But in very rare cases, ivermectin has been linked to very serious skin reactions. These are not simple rashes. These are medical emergencies. The skin can start peeling, blistering, and becoming extremely painful. The mouth, eyes, and private areas can also be affected. Fever, weakness, and body pain may follow. These reactions have scary names like Stevens-Johnson syndrome and toxic epidermal necrolysis. While they are rare, they are extremely serious and can even be fatal if not treated in hospital. What makes them more dangerous is that they can begin like a normal rash. A person may think it's just a small allergy. Then, within hours or days, it becomes much worse. Any unusual skin change after taking ivermectin should not be ignored. If the rash is spreading, forming blisters, or causing pain, it is a red flag. The medicine should be stopped and emergency care should be taken. It is always better to overreact than to ignore a warning sign from your skin. Your skin is your body's alarm system. Hidden effect number 4. Poisoning from overdose or veterinary ivermectin. One of the most shocking realities is that some people take ivermectin meant for animals. Horse or cattle versions of ivermectin are not made for humans. They are much stronger and contain different ingredients. During recent years, many people bought these versions online or from farm stores. They thought, it's the same medicine, but it is not. There have been many cases of poisoning from this mistake. People experienced extreme nausea, vomiting, low blood pressure, confusion, hallucinations, and even coma. Some were admitted in the ICU. A few did not survive. All of this happened because of misinformation and panic. Even human ivermectin can be dangerous if taken in high doses. More does not mean better. Too much ivermectin can overwhelm your system and shut down important functions in your body and brain. This is why dose matters. The body is built on balance. When you disturb that balance, the results can be deadly. A medicine only becomes a cure when used correctly. Otherwise, it becomes a poison. Hidden effect number 5. Dangerous reaction in people with certain parasites. Here is a hidden effect that most people have never heard of. In people infected with a parasite called loa loa, ivermectin can cause a severe reaction in the brain called encephalopathy. This can lead to swelling of the brain, confusion, coma, and even death. This parasite is mainly found in some parts of Africa. That is why doctors in those regions must first test for it before giving ivermectin. This shows something very important. A medicine that is safe in one person can be dangerous in another. It depends on what is already inside the body. This hidden risk is one of the reasons why mass treatment programs are done so carefully. Doctors don't just give a tablet. They check, they test, and they monitor. People who travel, migrate, or come from different countries should always tell their doctor where they have lived before. These details matter. A simple question like, "Where are you from?" can save a life. Medicine is not just about tablets. It is about the whole human story behind the patient. Hidden effect number 6. Special danger for pregnant women and children. Another group that needs extreme care with ivermectin is pregnant women, breastfeeding mothers, and young children. The developing brain of an unborn baby or a small child is much more sensitive than an adult's. Even small changes in chemicals can have long-term effects. That is why doctors are very careful when prescribing any medicine to these groups. While ivermectin is often considered safe in many cases, the risk-benefit balance is different for them. A pregnant woman must never take it without medical advice. A child should never be given it based on online instructions. Dose depends on weight, age, and overall health. The same applies to elderly people or those with liver and kidney disease. Their bodies cannot process medicine in the same way. The drug can stay longer in their system and create harm. What is safe for one person can be dangerous for another. Is not optional. It is necessary. Hidden effect number 7. Misinformation and social harm. The final hidden effect is not in the body. It is in society. Ivermectin became a victim of misinformation. People argued about it. Doctors were attacked. Families were divided. Some trusted science. Others trusted social media. This created confusion, fear, and real harm. Some people delayed proper treatment because they believed ivermectin was a cure for everything. Others overdosed because they thought more was better. Hospitals saw cases that never should have happened. All because the truth was buried under viral posts and false promises. This shows the power of information. A single post can harm thousands. A single video can mislead millions. This is why it is important to check facts, consult experts, and think critically. Medicine should be guided by science, not emotions or trends. One pill cannot replace education and responsibility. Ivermectin is not an enemy, but it is not a toy either. It is a powerful medicine that must be respected. If this video helped you understand it